Welcome. In this video, we'll be exploring interstitial lung disease, or ILD. This isn't a single disease, but rather a group of disorders that cause progressive scarring of the lungs. Join us as we delve into the causes, symptom diagnosis, and management of this complex condition. So, what causes ILD? The truth is, in many cases, the exact cause remains unknown. This is called idiopathic ILD. However, several factors are known to contribute. These include long-term exposure to certain environmental and occupational irritants, such as asbestos, silica dust, coal dust, and grain dust. Certain medications, including some chemotherapy drugs, heart medications, and antibiotics, can also trigger ILD. Connective tissue diseases like rheumatoid arthritis, lupus, and scleroderma are frequently associated with ILD. Genetic factors may also play a role, making some individuals more susceptible. Finally, certain infections like pneumonia and even radiation therapy to the chest can, in some instances, contribute to the development of ILD. Now, let's discuss the pathophysiology, or what's actually happening in the lungs. ILD involves inflammation and eventual scarring, or fibrosis, of the lung tissue, specifically the interstitium, the space between the air sacs. This scarring thickens the interstitium, making it difficult for oxygen to pass from the air sacs into the bloodstream. Over time, the lungs become stiff and less elastic, reducing their ability to expand and contract properly. This leads to shortness of breath and other respiratory problems. Think of it like trying to inflate a balloon that's been coated with glue. It becomes much harder, and you can't get as much air in. Understanding the epidemiology of ILD, how widespread it is important. Because ILD is a group of disorders, pinpointing exact numbers is challenging. However, it's estimated that ILD affects tens of thousands of people worldwide, with prevalence varying based on geographic location and specific risk factors. Certain types of ILD, like idiopathic pulmonary fibrosis or IPF, are more common in older adults, particularly men. Exposure to specific environmental toxins, like asbestos, greatly increases the risk in exposed populations. What are the telltale signs and symptoms of ILD? The most common symptom is progressive shortness of breath, especially with exertion. This can start subtly and gradually worsen over time. A dry hacking cough is another frequent symptom. As the disease progresses, individuals may experience fatigue, chest discomfort, and unintentional weight loss. Clubbing of the fingers and toes, where the fingertips become rounded and widened, is also a characteristic sign in some cases of ILD. Listen to your body and consult a doctor if you experience any of these persistent symptoms. Diagnosing ILD typically involves a combination of medical history, physical examination, and various diagnostic tests. A doctor will ask about your symptoms, medical history, and any potential exposures to environmental irritants. A chest X-ray can help visualize any abnormalities in the lungs. A high-resolution CT scan of the chest provides a more detailed view of the lung tissue and can help identify specific patterns of scarring. Pulmonary function tests measure how well your lungs are working, assessing lung capacity and airflow. In some cases, a lung biopsy, where a small sample of lung tissue is removed for examination under a microscope, may be necessary to confirm the diagnosis and identify the specific type of ILD. ILD is a broad category encompassing numerous subtypes. Idiopathic pulmonary fibrosis, or IPF, is the most common and most severe form. Other types include sarcoidosis, hypersensitivity pneumonitis, and ILD associated with connective tissue diseases. These different types of ILD have varying causes, disease progression, and treatment approaches, highlighting the importance of accurate diagnosis. While there's currently no cure for most forms of ILD, various treatments can help manage symptoms and slow disease progression. Pulmonary rehabilitation, which includes exercise training and breathing techniques, can improve lung function and quality of life. Oxygen therapy provides supplemental oxygen to alleviate shortness of breath. Medications, such as antifibrotic drugs, can help slow the progression of lung scarring in certain types of ILD, particularly IPF. In severe cases, a lung transplant may be considered. Managing underlying conditions, such as connective tissue diseases, is also crucial in treating associated ILD. Preventing ILD often involves minimizing exposure to known risk factors. Avoiding occupational and environmental irritants, such as asbestos and silica dust, is critical. Quitting smoking is essential, as smoking can worsen lung damage and increase the risk of ILD. Prompt treatment of respiratory infections can also help reduce the risk of developing ILD in susceptible individuals. The prognosis, or expected course of the disease, varies depending on the type of ILD, its severity, and the individual's overall health. Some types of ILD progress slowly, while others progress more rapidly. Recent research has focused on identifying new biomarkers to predict disease progression and developing more effective therapies, including novel antifibrotic drugs and targeted therapies. Clinical trials are ongoing to evaluate these new treatments and improve the outcomes for individuals with ILD. The hope is that continued research will lead to more effective ways to treat and even prevent this debilitating lung disease.